I'm Dr. Chirantika Vitana, consultant community physician handling Adolescent and Youth Health Program, the National Program Manager, Adolescent and Youth Health, Family Health Bureau, Ministry of Health. Today we are starting the first session of 5-day workshop on Adolescent and Youth Health. So, our target audience is you all officers working with adolescent and youth and officers who are developing adolescents and youth on adolescent and youth health. At the end of the program, you will be knowledgeable on adolescent and youth health, available services, and how to develop skills of adolescent and youth in the present world with all the challenges. So, we will start first session. In first session, I'll be talking about adolescent, youth and young person. Objectives of today's sessions are to describe the basic concept and definitions pertaining to adolescent, youth and young person. So, there are definitions globally, not all are clear cut, but we will describe and we will identify what are the basic concepts and definitions. And it is very important for us to compare present and past. Today's adolescents are a bit different from us. Why they are different? How they are similar. So, we will compare past with present. And we will discuss why adolescent is neither a child nor an adult. That is very important for us as the officers working on adolescent and youth health. So, why should we invest on adolescent health or youth health? That means young person's health. We should know why we should invest in order to get resources and in order to work with them and to provide better service for them. And we should be empathetic toward young persons. They are a bit different. What are their needs? Why we should invest, and we should be empathetic toward them. So, as we discuss, basic concepts that we will cover are adolescent, youth, young persons, experiences of present and past regarding adolescent and why we should invest on them. So, what do you understand by child, adolescent, youth and young person? According to UN definition, child is a person up to 18 years. So, adolescent is 10 to 19 years. So, adolescent are taken as children. So, these are the definitions. Young persons are adolescent and youth. So, who are adolescents? They are 10 to 19 year age group people. Youth, they are 15 to 24 years. That is for health sector. In other sectors, they will take as 15 to 29. Collectively, we call them 10 to 24 year age group as young person. So, we are doing this about young person. This is the diagrammatic presentation of same 0 to 18 children, 10 to 19 adolescent, 15 to 24 youth, collectively 10 to 24 young persons. Adults are those above 18 years. So, what is adolescence? Adolescent is the second decade of life during which period there is a transition happening. Transition is from childhood to adulthood. So, it's not an easy period for adolescent as well as their parents, teachers. In this space in which an individual is no longer a child but is not yet an adult. So, we have to realize it. If we take the global context, in global context, young persons are about 1/4 of world population, nearly 1 billion. They are young people. So, when we come to Sri Lankan context, in last census, our population was 20.4 million. Of that, 5 million were young person. Today, it's much more, little bit more. From total population, 16% are adolescent. From these adolescents, 71% are school going, 29% are out of school. They are not going to school. Some may be following vocational training, some may be at workplaces, some may not have any particular training or job. So they are at more risk. Those who are out of school are at a higher risk than those who are going to school. Youth are about 15.6 of the population. Collectively, young persons in Sri Lanka are 24% of the population. That means nearly 1/4 of Sri Lankan population are young persons. So, when it comes to the rights, if we talk about human rights, as adults we are having human rights. Children, that means up to 18, that is covering adolescent also, are having same rights. In addition to that, they have a big right for protection. So that is very important. Rights of the children are mainly to survive, grow and develop. Committee on Right of Child, that committee oversees the Child Right Convention. That is UN rectification that we all have agreed as states. Child Right Convention guidelines highlight states' obligation to recognize rights of adolescent and young people. So it's very important. As government officials, we have to ensure rights of adolescents and youth. It includes obligation for recognition of their development, health, well-being, special health needs as well. So, shall we recall our own experiences during adolescence and also today's adolescents' experiences? How they differ? What are the similarities? So, there are similarities, there are differences, and we can see as adult what we are doing we didn't do as adolescent. But in today's adolescent, there are several environment factors affecting their behaviors like mobile phones, IT, and also social interactions are limited. We will all discuss those things. One thing we have to see is if we are telling a child or adolescent that you are no longer a child. When are we telling like that? If we want them to do some homework, help us in household work, then at another time for the same child, we will tell you are still a child. When they are giving us instructions, when they are following our discussions, we are telling them you are still a child. This is not your business. At another time, we are telling you are no longer a child, you have to do this. So imagine what confusion that adolescent will have if we are going to tell those things for a same adolescent. So there's a big need to invest in adolescent health. So what is the need for investing on health of young person? That means adolescents and youth. We will see. Why adolescent health is important? It's a crucial time for health needs. We have identified it. And what is this need? They are still growing, puberty is happening, and hormonal changes and brain development are happening. Why they are a bit different? There's a scientific reason. Because of the puberty, pubertal hormones are causing puberty. they get feelings, they are changing from childhood, and in addition to that, their brain development is not optimum. Actually, size of the brain has achieved adult size, but brain maturation starts from the back side of the brain. It goes up to front. Front, last part to mature is prefrontal cortex. Prefrontal cortex is essential for rational decision making, like considering the causes, what will be the effects, and what decisions we will have to take, and planning also higher level functions. But their prefrontal cortex is not mature, it will mature at mid 20s, that means 25. With becoming older, they are capable of this sort of decision making, but optimum development is still not there. But the centers uh, handling emotions like limbic system are developed. They take decisions from these centers. They don't see the consequence, they don't see the root causes, they take decisions. That is the gap. So as adult and service providers, officers developing these adolescents, we have to know it, and we have to help them to improve the high level functions. They have emotions, but they don't have impulse control. They take the risk, uh, and that cause harm for them. They go for unhealthy behaviors like tobacco use, alcohol use, substance abuse if they are not properly developed. So it's a crucial time. It is a time that risk behaviors begin, which may last lifelong. So as I discussed, that is the reason for it. Brain development is not still optimum, and hormonal changes are happening. First sign of many serious long-term conditions emerge in this age, like mental health diseases, non-communicable diseases. So we have to intervene early. So there are some more reasons. Many adolescents die due to accidents, suicide, violence, early pregnancy complications, and other illness. All these are preventable. Number of adolescents dying is not that big as infants or under 5 children, but we don't want any of adolescents to die. So they are apparently healthy, but they will try risk behaviors that will cause all these morbidity and mortality. So we can prevent it. Many serious diseases in adulthood have the root causes in adolescence, like as I discussed earlier, tobacco use, sexually transmitted diseases due to unsafe sexual behaviors, poor eating, that means unhealthy dietary habits, lack of exercise, uh, all will cause mere serious non-communicable diseases in early adulthood, that prematurely. So, we know all those things, but we will see what are the evidence-based findings. This is according to global and local research. They are not listening up. Adolescent youth are not listening up. They lack information. We have several sources of information, but they lack information. Difficulty in accessing services. Services are there. Services should be available, much more accessible, acceptable, and adolescent and youth friendly. Are we providing those services? Services are not being adolescent friendly was found in their perspective among surveys among adolescents. So there are some more reasons. As we discussed, there are about 1 billion adolescents in the world. In some countries, 1/4. In some countries, 1/6 of its population. And yet, governments have generally overlooked their health needs. Due priority is not given for adolescent and youth. So, we will see in this diagrammatic form why we should invest on adolescent. If we invest on childhood, early childhood development, prevention of communicable diseases, vaccination, If they are healthy in adolescence, they tend to be healthy in adulthood also. So, if adults are healthy, they will be healthy throughout the life and offsprings will be healthy. Then means the children born to this group will be healthy. If children get due care, protection, ECCD, they will be healthy in adolescence. So, this is a vicious cycle. So, we have to develop adolescence. We have to provide necessary care, we have to ensure health and well-being. They will get the missed opportunities in the childhood as well. Then we will get better future for adulthood as well as next generation. So, there are three levels of gains if we invest on adolescent and youth. Individual gains. We will see what are the individual gains. There are immediate gains, immediate benefits. What are these immediate benefits? Promotion of positive behaviors. That means developing positive dietary habit, physical activity, how to say no for drug or alcohol, like that. Protection and prevention of from unhealthy lifestyle and its consequences, NCDs. So we will go discuss the future benefits for individuals. So establishment of healthy lifestyles, as we discussed, healthy diet, physical activity, and how to say no for drugs and alcohol and unsafe sex, how to say no for that. These things. So establishment of healthy lifestyle will be a future benefit. And also protection from harmful exposures, conditions and behaviors in order to reduce mortality. If we are protected from these things, harmful exposures and behaviors, we are protected. And that will reduce morbidity as well as mortality. So benefits for next generation. That we discuss benefits for future, this is for next generation. Health promotion and prevention of unhealthy lifestyles and disease status will protect the offspring. That means if we are healthy as a mother and father, the offspring will be healthy. So in adolescent, if we are healthy, that will go up to next generation. And what are the overall gains? So there are overall gains as well. Overall gains are economic and social benefits. So we are ensuring here there will be economic and societal benefits. What are these? This occurs through great productivity. So if we develop adolescent, if they are free from disease, if they are healthy, their well-being is ensured, their life skills are developed, there will be greater productivity and reduce health cost and enhance social capital. That will enhance the social capital. That is very well understood. Increase in investment will lead to reduced mortality and fertility rates. This will increase the proportion of economically productive group. So we will have an economically productive group. So it is a demographic bonus. We are having demographic bonus there, which lead to accelerated economic growth of the nation. So we had such opportunity was observed in Sri Lanka from 1990 to 2017. Have we taken the use of this period? That is for you to think. Now we will come to health benefits. It will reduce mortality, morbidity, regarding to STI, pregnancy, disability due to injury. This injury is the leading cause of death among adolescent and youth. Reduce mortality due to those things with high risk behaviors, premature death due to NCDs. So ultimately we are going for sustainable development goals. How many sustainable development goals are there? There are 17 globally accepted sustainable development goals. If we are to achieve those things, how can we achieve them? So it is important that we will uplift the care, protection, development, everything of adolescent and youth. In order to achieve all 17 sustainable development goals, we have to do it. Third goal is on health. Fourth goal is on education. They are directly related to adolescent and youth. So, future healthy lives and promote well-being for all ages, it is very much essential to invest on adolescent and youth. There are certain other advantages. Sustainable gains have been made from extensively investing on maternal and child health program up to now. So we have gained everything from that. All those gains will be of no value if we don't invest much on adolescent health program. We can't forget that period. Such investments will further develop, sustain and strengthen successful health investment from which children have benefited, that is shown. It will also correct earlier health deficits if there were any in infancy and early childhood. Current thinking regarding adolescents. We have discussed adolescents are different and they are not same. Even when we were adolescent, we were not same as adults. We didn't think about the consequences. We thought that we know everything. Today's adolescents are also same. I will quote one of the thing mentioned by William Shakespeare. It's from William Shakespeare's Winter Tales storybook. And there he says it would have been better if there were no age of adolescence. That means 10 to 23, according to him. If youth will sleep in this period, he tells it is good. Why? Because what they are doing is getting pregnant, stealing, wronging ancestry. So even in those past periods, they have identified adolescent is different. Now we all know they were different in that our ancient period. When we were adolescent, we were different. Today's adolescents were also different. Only difference is that they have more opportunities like IT, mobile phone addiction, drug use, like that, what we didn't have as adolescents. We had good relationships within adolescent, but they are lacking that environment. Anyway, adolescents are different. So, people think it is very difficult to handle them, but it is not so. From evidence in the literature, most adolescents can navigate through this transition without major setbacks. So, we have to help them. We are not going to tell them that you don't have brain or anything, but we have to understand their views and we should be with them and we should properly guide them. They are capable of strengthening their own identity and maintaining relationships with parents, peers, and others. So we have to respect their privacy, their identity. We have to help them to build those things. Not only us, teachers, parents should do it. So ultimately, I would like to ask, why should there be an attitudinal change regarding to be empathetic in dealing with adolescents? So, some of you are providing health care, some are teachers, some are instructors. So you will be developing adolescent and youth, their life skills, how to say no for unhealthy things, develop proper skills, self-identity, self-awareness, everything we will talk. But only thing is, we don't have to be sympathetic, but we have to be empathetic. We have to understand their things in their perspective. We have to be always with them, and that is how we should provide care, how we should develop them. So, much more will be discussed within the course. This is the introduction for adolescent and youth. So, all the books are there, you can read. So, this is for a better world. So, we will get together and develop adolescent health and contribute to adolescent and youth health for a better future for the world. Thank you.